All right, welcome everyone. We are going to get started. So I just want to say first, I'm so happy to have everyone here today. I'm really excited to have this conversation with our panelists today. I want to introduce myself. My name is Magdalene Wellman, and I am a program manager for Community Campus Partnerships for Health. And we are here to celebrate 25 years of partnerships. CCPH has been celebrating partnerships and really showcasing the importance and value of partnerships for the past 25 years. And as our organization continues to grow, we really continue to affirm these partnerships and the approaches to health, because we really want to focus on changing the conditions where people live, work, play, pray, and study. So throughout this year, CCPH will celebrate the lessons that we've learned. We're going to celebrate the impacts of our work and really set the stage for our future endeavors as we look to continue to redefine what it means to partner. So over the past 2.5 years, as we all know, the world has faced like a global pandemic, which has really called into question the ways that we approach health. And recognizing, that the COVID-19 pandemic couldn't be fought with a single approach, governments and health systems were forced to reconfigure how they engage and also how they partner with communities. And CCPH, as an authority in partnerships, has really supported these shifts and currently remains involved in partnerships across the COVID-19 realm, from testing to long COVID. And so our discussion today will actually be with our initial COVID-19 partnership with the Duke Clinical Research Institute and the University of North Carolina, Chapel Hill Center for Health Equity Research. So we are excited to get into this conversation. Just a little bit of background about this partnership. So this partnership leads a research center known as the CDCC, or the Coordination Data and Collection Center, for those who are not familiar. And it manages a national research initiative, RADx-UP, which stands for Rapid Acceleration of Diagnostics in Underserved Populations. And this initiative currently manages 125 plus projects across the country that are all working to address COVID-19 testing disparities in underserved populations. So throughout this hour, we really kind of want to explore and dig deeper into this partnership. We want to talk about the lessons that we've learned while partnering during this public health crisis and really how they can inform future partnerships. And then we want to highlight the assets that have come out of this pandemic. We've learned a lot in a short period of time, and we've had a lot of resources that have been formed and developed that can really help us as we move in the future. So before we get started in this discussion, I just kind of want to take a few minutes to introduce our panel. Many of you are familiar with a lot of our panelists. They've worked together for the past 2.5 years. But some of our panelists have actually known each other for more than 20 years. So let's take a few minutes to introduce them. I want to start with Al Richmond. He is my executive director at the Community Campus Partnerships for Health. He is also the co-lead for the Community Engagement Core here at the RADx-UP CDCC. He's also the co-principal investigator for the North Carolina SEAL Project. And he's a member of PCORI's Patient Engagement Advisory Panel. That is a lot to say, so just bear with me. But I also want to share just a little interesting thing about Al outside of RADx-UP. Al is also an executive coach with the International Coaching Federation. So, people who are in need of executive coaching, Al is your person. So thank you, Al, for joining us. I also want to introduce Dr. Giselle Corbie. She is a Keenan Distinguished Professor in the Departments of Social Medicine and Medicine at the University of North Carolina School of Medicine. That's a lot of medicine. She is also the director for the Center for Health Equity Research at UNC, and she is a principal investigator for RADx-UP CDCC, primarily with doing primary oversight over the Community Engagement Core. Just a quick interesting fact about Giselle. Giselle hosts a podcast, and it's called A Different Kind of Leader. And this podcast really features diverse leaders, and they talk about their journeys, the things they've learned, and their experiences in both their leadership journeys, but also in their personal journeys. And so we really encourage you, look up the podcast, take a listen, and learn more as you also are venturing through your own journeys. So thank you for joining us today, Giselle. And then I'd also like to introduce Dr. Warren Kibbe. He is the professor and Vice Chair of Biostatistics and Bioinformatics at the Duke University School of Medicine. He is also a Chief Data Officer for the Duke Cancer Institute, and he is another of our esteemed principal investigators for the RADx-UP CDCC. He provides primary broad oversight over the data science and biostatistics core. And just another fun fact, Warren is an avid cyclist. For those of you who don't know, Warren has bicycled to work for 28 years. 15 of those, he cycled 13 miles each way in Chicago. Take a minute to think about that, people. So outside of being in great shape, he apparently loves to be outdoors and really kind of take in nature. So let's welcome Warren. And then before we get started, I just want to mention that one of our PIs unfortunately was not able to join us, but we do want to recognize him, and his name is Dr. Michael Cohen-Wokolitz, or Mickey as he is known to us. And he is a Kaiser Arena Distinguished Professor of Pediatrics at Duke University. So thank you to all of our panelists. Before we get started in this conversation, I just really want to take a second to acknowledge to our audience that you are a part of this conversation and we want to hear from you. So throughout, if you have questions, please feel free to share them in the Q&A box. You can also feel free to share your thoughts in the chat. But we want to kind of get started so we can dig in and have time to really engage in this discussion. So, you know, today's conversation is really all about partnerships, right? So I want to know from the audience before we get started with the panelists, what do you value most when establishing partnerships, whether it's with a community organization or whether it's with an academic institution? So we've got a poll up. Take a minute, answer this poll. And then we will look at your results and dig into the conversation. All right, we'll give it another minute. All right. So all of the above, that's what we like to hear. Trustworthiness, transparency, cultural humility, all of these things are important and things that should be valued as we look to establish, you know, these community academic partnerships. So thank you for taking the time to share that. And really, you know, it's as we continue in this conversation, think about these things and think about how they relate to partnerships that you may be involved in. All right, so I know let's get to what everybody came to hear about. So just want to keep in mind with everybody, this is a conversation, like this isn't formal. We really just want to kind of get to know more about this partnership, but also really get to know more about what we've learned and kind of what we've experienced. So, you know, the work during the past 2.5 years through the RADx-UP Coordination Data Collection Center, or the CDCC, has really been fast-paced, but it's also been very impactful. You know, so I want to check in with each of our panelists and just I'll start with you, Al. You know, how are you? And kind of as you reflect on this 2.5 years, you know, what are you thinking about as you reflect back? Oh, you're muted, Al.
I should know that, right? So first of all, thank you, Magdalene. And I want to say welcome, Warren, and welcome Giselle and Mickey, who's not here, to our party today. So I feel like we should have some confetti and just be celebrating in this moment, but we'll have more times to celebrate. So just welcome to all of you, as you know, all of those of you who have joined us this afternoon. I think for me, I'm feeling a little overwhelmed. I continue to feel the pressure actually that has come from the work that we've been doing. Certainly it's a lot of great work, but I think the motivation behind that work in terms of a global pandemic has really been sad for me in terms of the loss of life globally and the long-term effects of COVID-19. So it's been an amazing time of growth, but in some ways it's been a bit sad. And so I'm kind of balancing and holding those two truths, you know, for me.
Yeah. I mean, I think it has been a sad time, but I also think it's been a time where we've learned a lot, not just about ourselves, but really about being able to adapt and pivot. But I want to also share that, post that question to Warren and Giselle, like, how are you feeling? And, as you reflect back on these past 2.5 years, what are your thoughts?
Well, first of all, Magdalene and Al, thank you so much for letting me be able to be here with you to celebrate this tremendous accomplishment, 25 years. I remember conversations with Al as he was considering taking on the leadership of CCPH. I think it probably, while I'm not at all surprised by the outstanding leadership he's provided, I do remember and fondly remember that conversation.
Mhm.
So how am I? I'm tired.
You're not alone. You're not alone.
A lot of it is there's both the physical nature of this work of sort of long days and longer nights. There's the emotional impact of this work as a clinician, as a general internist, as well as a researcher. So, and this sort of the roller coaster ride we've been on for the last 2.5 years. There's both a tremendous sense of loss in terms of the loss of life, even early on in the pandemic, before we really understood the magnitude, the loss of dignity and the respect for human dignity that we saw as sort of the inequalities kept mounting, and there wasn't the sort of quick response that we all would have expected. And then seeing that sort of cycle through, not only in terms of access to testing, access to vaccines, and here we are now in terms of access to treatment. That's coupled with this bittersweet opening for health equity researchers and community engaged researchers, and so much of what we've been sort of hammering at doors and stomping our feet became so clearly revealed for folks, but in such a bittersweet way, where it's like that would not have been the way that I would have wanted this work to have been realized. Certainly not at the cost of the vast cost of human life that we're still experiencing. And so there's a fatigue that sets in. I mean, it sort of bubbles up in different times, right? I've just been, this last couple of days, I've been part of a leadership development program where we had a COVID exposure. We had somebody, COVID positive, and sort of, okay, we're not out of this yet. What are we going to do? How do we protect people? What are we going to do to ensure folks feel safe and comfortable? Do we keep moving forward? And if so, how? And how do we give folks the grace and the space for them to make decisions that are in concert with their values and beliefs in that moment? So it's been incredible. RADx-UP, and I'm going to let Warren speak because you haven't actually asked the question about this partnership, but it's been sort of that bright spot in the midst of it. Certainly, Al and I have known each other for over 20 years and collaborated for most of that time. But this particular moment where RADx-UP sort of, came, again, it's this British sweet moment to see the kind of investment NIH has made, sort of unprecedented investment in the health of historically marginalized and minoritized populations, but also a new collaboration, a new way of thinking about the work that we do. That's been exciting. And, so I'm grateful in that way. I'll let Warren speak. I've already taken up way more time than I thought I would.
No, we want to hear from everybody. Like I said, this is a conversation, and we really want to be able to kind of take some time to really express these thoughts and speak around them. So, Warren?
Well, for my part, I love hearing all of you speak. I just appreciate the graciousness that you provide to all of us when we're trying to do this really important work. And I got to say that before the pandemic, I had not realized just how important this work would be. The gravity of it is just, it is shocking. Something I want to point out, and Al, thank you so much for arranging this, for CCPH supporting it. But watching the color of care the other day it just brought so many pieces of what we've all been seeing to home, and it is profoundly sad, those parts. But the community we've brought together, the work we're doing, it fills me with a lot of hope and a lot of joy. Frankly, working with all of you has just been such a beautiful thing. I thank you for that. And I just, again, it's of course it's a lot of hard work. It's been filled with all kinds of I'd say unexpected joys along the way. Just finding out how can we intervene in people's lives, which is the work that CCPH and Giselle, you've been doing for years. But thank you for bringing me into this world, because it's just not something I'd ever done before. I appreciate your patience in bringing me along. So
Yeah.
I don't know. I don't know how to end that, but thank you.
Warren, I want to just chime in and say, I think this conversation already is amazing, and that what people don't often think about are the people who are leading the work, how the work impacts them, right? And the difference it makes. And so if we are leaders in any regard, in any respect, we're human first. And so as we attempt to lead the work, we're impacted by the work. Right. And that's what I hear you saying, is how the work has really impacted you and shaped you as a leader, as a scientist, and as an academic. And I think that's what we all want, right? Is that transformative experience that comes about as a result of our work, and that it moves from just being kind of academic to being almost personal, if you will. And that's really powerful. So thank you for sharing that.
And I will say that's one of the lessons for me that over the last couple of years is just the recognition, particularly for those of us that are in this space to where our work is hoping to advance health equity, is that we need to extend grace to each other. Everybody is working harder than they have ever worked before. And you'd have no idea the deeply personal way that they might be impacted by this pandemic, or any of the other health inequalities that were there before 2020 or 2019. And for me, the learning for me has been that we have to extend grace to folks, that if someone makes a commitment and they're not able to meet that commitment, there's probably a really good reason, because those of us in this space doing this work are deeply committed to it. It's not something that it's a nice to have, it's a gotta have. And in my experience, everyone that comes to this work has a personal and lived experience with inequality that brings them to this space. And it's not an academic pursuit. It is personal, and it becomes very deeply personal and impacting, as Al said, impactful for folks in ways that are both celebratory and might be ways that actually lead to grief and sadness as well.
Yeah, just thinking about, before we venture back one step, but just thinking about that. Yeah, I mean, I think as we think about the pandemic, I think initially think of like how hard it has been and all of the changes and stuff it's required. But on the positive side, it has, evoked change in area and evoked awareness in areas that, for many people for a long time, that hasn't been there, and they've been wanting that to be there. It's unfortunate that it happened this way, but, as you all are saying, it's moving us in directions that if this hadn't happened, who knows when when we would have started to really move in these directions. So, I do think that's something important that we can take from this. So just taking one step back, even though I hate to take this step back because like the conversation is getting really good, but I really want to kind of take a step back and really talk about the dynamics of the partnership and how it all came together. How did this partnership come together? I don't know who'd like to try and answer that one first or step in first.
Well,
Uh,
I'll say from my perspective, it was really
Go ahead,
Giselle and Ellen and Al coming together and saying, we need to do this. And that's the way I think of it. But, Al, please.
That's not how I remember it. That's not, I remember what I remember is getting a call or an email back in 2019, I think it was, saying that there was this opportunity to work. And Giselle, as we've done for 20 years, she's like, well, if I'm going to be involved in it, you're going to be involved in it by default. And so I was like, sure, whatever it is.
And Al, I think that is exactly Giselle.
Right. Giselle is like the linchpin of this entire partnership, actually, when I think about it. So she reached out to me and said that, and this is interesting, and everyone may not know this, is that prior to 2019, I did not know Mickey and Warren. And I don't think they knew me or had heard of CCPH. And not disparagingly, it's just they didn't. And so we didn't know each other. And Giselle reached out to all these people. And I believe Mickey had actually started conversations. And I was shocked. I mean, I received another email and said, we got it. And I was like, are you serious? $80 million. So yeah, this was an $80 million venture by the National Institutes of Health to stand up the Coordination Data Collection Center around testing. And as they say, the rest is history. So that's how I remember. Giselle, how do you remember it?
Yeah, I was going to say, maybe I can correct in terms of my remembrance of it. And so what I remember is getting a text message from a colleague of both Mickey and myself to say, you're going to get a call from this guy. I think you should go ahead and do this. And I was like, okay, look, I saw the RFA, but I was like, we were actually working on our own application to the RADx-UP. I wasn't thinking about the coordinating center. And so Mickey called me and, based on this recommendation from a mutual colleague at Duke, I was like, all right, well, let's do it. I mean, what's the worst that could happen, right? We don't get it. We're no further back than we were before. And so it was a series of very intense, very brisk, high power conversations. I actually don't think Warren and I were ever on the same call at the same time until after we were funded. I just don't remember us ever being on the same call.
You might be right.
Yeah.
I think I think you and I had at least one conversation before we were funded, but you're right. I don't think the calls were intense. I kind of blocked some of that out, I have to say.
I mean, I remember being at the beach with my kids and my nieces and nephew, and like standing on the porch while they're doing whatever they're doing inside and fielding calls and just, trying to pull this together. It was really there's some outstanding team members, both at UNC and at DCRI, that this could not have come together without their skill set and their expertise in being able to pull this kind of large project together. And so,
but none of it would have worked, Giselle, without you or Al being part of it.
Yeah.
Well,
absolutely,
and none of it would have worked if we didn't have this incredible team of logistics, research, expert staff to make this happen. We had some grand ideas, but then they were left trying to figure out, okay, first of all, how do we get that on paper? And then how do we, holy moly, we actually got the grant. Now, how do we actually implement that? And then the teams at DCRI, Duke, UNC Chapel Hill, and CCPH, it was just this Herculean effort to stand this up. And it was just beautiful, magical, the way things happened. I mean, we all went through this sort of norming, forming, storming, and reforming. That is just part of the process of team building. But
Mhm.
these research professionals were just remarkable in their ability to come together, bridge institutional cultural differences. We're talking about 3 different institutions and organizations and cultures, to be able to bridge those cultures, to think about the logistics as well as think about the team building. It's really remarkable.
Yeah. I mean,
Yeah.
as we
Well,
celebrate I was going to say, Warren, as we celebrate our 25th anniversary for the next year, this was, certainly the largest endeavor that I'd ever taken on as the executive of CCPH. And I think really, arguably in our history. And I think the other piece of it is that I keep saying to people, we were made for this. Like, so Magdalene, you were talking about the good that came out of it was that I believe that we as an organization, CCPH, was able to step forward in this moment. What made this proposal, I think, really powerful and unique was that it was the first time that I've been made aware of where you had an organization like CCPH, a nonprofit, a community-based organization, to really step in as really an equal partner in this work. And I realized that as I was thinking about, what I would say today was that when I received the first piece of branding material and it had CCPH's logo beside DCRI and UNC, I was like, it's real. Like I thought, oh my God, it's really real. My heart just leaped with so much joy and excitement at this opportunity. But it was also very humbling for us as well to think about the fact that we would be leading this effort. And for us, what it has meant is that CCPH is currently involved in pretty much every large scale NIH funded COVID relief project, from testing to COVID-19 mitigation strategies through the SEAL initiative. And now we're focused on Recover to look at the long-term effects of COVID in the lives of individuals and families. That's amazing. For us to be able to cover literally the continuum of COVID response. And I think that was all where we are today is largely in part because of the work that we've done through RADx-UP, quite frankly. It just has allowed us this platform to showcase our work, to put into action what we've been talking about for 25 years.
Yeah, definitely. I mean, I think it's done that for many organizations and brought many partnerships together that people may not have even considered or fathomed before this, right? Like they never would have thought this would be a community they would be working in. They never thought this would be an organization they would be working with. And now they form these partnerships, which have the potential to become long-term partnerships, to continue to do work in communities and, continue to affect health in different ways. And just kind of thinking about that, as thinking about how your partnership came together and the networks that have been built as a result, of this partnership between DCRI, UNC, and CCPH. And, thinking about things in the future, how do you feel, what would you recommend for other partnerships that are now forming these networks? Let me stop there. How do we support these networks as they continue to work to leverage the partnerships that they've developed for future public health initiatives?
So before I answer that question, and I'll try to answer it, I'm not sure I have an answer actually, but
Okay.
I want to go back to the team building part because
Yeah.
I've been really blessed in my professional career several times to have been part of some really big things that have really taken off like we have. And when I look at them, each one, what made them special is the fact that there was a vision behind it that was so incredibly important that everybody jumped behind. And so before this, almost all those experiences for me have been around cancer, right? It's been around trying to actually change outcomes for cancer patients. And it's hard to find somebody that, one, isn't impacted by that, and two, doesn't care deeply about it. So it's actually pretty easy to get a diverse group of people all moving in the same direction if you clearly articulate where you're headed. And I feel like that's what we've done for RADx-UP is in particular, Giselle and Al have really been able to articulate, here's where we're headed. This is how it's going to help communities. This is how it's going to turn around hundreds of years of health inequities. And it's hard not to get people excited about that. It's hard not to say, well, I want to be a part of that because it's so important. So to me, that's, you can have these kind of, what's the term? These unicorns that kind of arise and no one really understands them. But that's actually not what we are. We're doing something really so important. It's hard not to get people excited about it. I mean, you brought me in, and I've never been in this space, and I'm incredibly excited about being here and contributing and seeing how we can really change these things. And I've got to say, at the same time, I'm always in the back of my head, I'm worried that, will we just go back to the way it's always been? I got to say, that's that's the fear that sits in the back of my head all the time, is how do we make this change for real? And I think you're getting at one of those ways. How do we extend this into all these different community activities? How do we make sure that we really inform policy at every level, local, the state, nationally, and we make sure that in fact people pay attention? And I think people right now are paying attention. But it's so easy to, I don't know, just to go back and embrace the status quo because it requires a certain amount of effort not to.
Oh, yeah. Yeah. It is easier to do what you've always done, right? It's harder to make change. But I think, go ahead.
At the same time, I hear all kinds of folks in the public health space, in government, and local people say, we've got to change this. This isn't, not only is it not fair, this is really impacting everybody's life. It truly is. And there's been so many conversations that I'm just hopeful that it doesn't end here. So I think your question's a great one. I don't know how to make sure we bring everybody in who can really benefit, but that's a great problem to have. How do we help everybody?
Yeah, I mean, I think a key component of the CDCC and RADx-UP has been not just establishing these academic community community organization partnerships, but now that people are in this work and they're doing this work together, how do we support them to continue these partnerships and to continue to grow in these partnerships so that they can become sustainable and work across all kinds of different areas?
Yeah, I like the toolbox. I think that was the start, right?
Yeah. I think that first, let me just address one thing that both you and Warren have picked up on, and I just want to extend. The fabric of this country is built on structural oppression, and so the bands of that oppression and the intersecting ways that those policies, practices, norms show up in our lives are deep and strong. And if we are not intentional, they will snap us exactly right back to where we were. And so it will require a concerted, deliberate, and focused effort. And in that regard, I will say, going back to when you asked how I was and saying I'm tired, I'll go back to this metaphor that a colleague shared at the Society of General Internal Medicine, and several of you might have heard this metaphor that he shared was about holding the note. He gave a lightning talk about holding the note in the setting. He does LGBTQ health and advocacy, and he says in a choir, when there's a long note to be held, everyone doesn't hold the note at the same time. Some start out holding the note. When that person gets fatigued, another person picks up the note and keeps holding it until you get to the end of the note. And I think in this work around health equity, we have to be intentional about how we're holding that note, because otherwise we're going to get burnt out. How are we building that succession plan? How are we building and supporting those that are holding the notes so that they can carry on? How are we, filling up our cup, right? Because you can't pour from an empty cup. How are we investing in that self-care and ensuring that we're able to be fully present in this work? So that holding the note, I think, is part of that network, is ensuring that we actually seed that across the network. Because I imagine I'm not the only one that's tired. And it's not just because of today or yesterday, what I had to deal with, right? This is a 30-year career of holding the note and, having colleagues like Al that I know will pick up the note, when I need to step back, and vice versa. In terms of the network, I think that that's an intentionality that we actually need to pick up now in RADx-UP. We have been thoughtful and really gone back to the literature about a community of practice for the work that we're doing, and how do we develop that community of practice. I think, we started out and then shifted based on that literature, but we need to think about how do we sustain that community of practice? How does it become self-sustaining? Or what kind of infrastructure do we need to put in place to continue to support those that are doing this work in the projects, as well as, at the coordinating center?
Exactly. Yeah, I agree.
Yeah, Giselle, I want to, I was looking at the questions that were coming in, and one person had a question specifically for you and I. Ashley asked the question, looking back over the past 20 years that you have known each other, did you see a partnership of this caliber or as large of an investment from a federal entity in health disparity research? So I wanted to kind of pivot to that a little bit, because I think that picks up on that piece there that you mentioned, that our engagement in this work was only made possible because of the investment from NIH. But let me say this and be very clear about it. And that sounds like a political statement there, right? And that is that it's not that we did not have the capacity to do the work. The skill, the know-how, the desire, the passion, and all of that. But every day, there are hundreds of thousands of community-based organizations across this United States and globally, national NGOs. They can do the work, but they lack the resources. And that's what made the difference in this moment. If I had a concern as a result of this conversation, is that I've been asking people, is this a moment or is this a movement, right? So if it's just a moment, then we take in all the resources that we can. We just dismantle what we've started and we go on our ways and we resume our work. I think if it's a movement, then we say we mobilize what we have in this moment, and we are very intentional. And that intentionality requires not just the engagement of community-based organizations, but philanthropy, federal government, other sectors to step in and say, you know what, we cannot go back to business as usual. We really need to fund this work. And that requires the funding of an infrastructure. I'm hearing every day, I received a call and an email, urgent email from a colleague in rural community saying, Al, we hired all of these community health workers to mount a campaign against COVID-19, and the funding is going away. And we need these people. We need them to address cardiovascular disease and hypertension and asthma and cancer in our community. So what do we do? So again, thinking, we have to think long-term and not just in the moment. I just wanted to pick up on that piece, because this really is about funding. I mean, every day, in every single way, it's about funding, in particular from the perspective of community-based organizations.
And I would say funding as well as strategy, and really thinking about how do we build community resilience. This has been a community disaster of epic proportions. One, as the rhetoric says, that none of us have seen in our lifetime, and yet there are communities throughout this country who are seeing community disasters on a regular and consistent basis. On the eastern part of North Carolina, every year there's a hurricane that hits Princeville. There's a hurricane that hits the eastern part of our state. Robson County, to the point where the mold mitigation strategies are just, it's just sort of normal and par for the course in those areas. And so how do we, as Al has said, how do we take a community preparedness model, a community resilience model, and layer on, so that there's always preparedness, layer on the ability to address more chronic illnesses, hypertension, diabetes, cardiovascular disease, cancer, that these counties also in the eastern part of the state are disproportionately impacted by. And so it's got to be a both and. People are getting COVID fatigue. I'm certainly tired, as I mentioned before. As impactful, as important this work has been, it's also been exhausting. And so how do we ensure that we don't lose that momentum of that infrastructure that has been created, the network that's been created? How do we layer on top of that all of the things that were there before COVID have been put on hold? One of the things as a primary care provider I'm concerned about is, what's we're looking at long COVID, but we also need to be looking at, after this pandemic, what are those inequalities look like that were there before the pandemic? Hypertension, diabetes, and all of the sort of poor health outcomes related to those underlying conditions.
Wow.
Exactly. I mean, and thinking about what you're saying, so now, okay, so we're 2.5 years out, right? So we're kind of at this point, we're in COVID fatigue, but the conditions are still there. People still have these, have these disparities, all of these other comorbidities. So thinking about that, if you could go back in time and step back, what would you do differently so that you, moving forward, would already be working towards this effect that you would like to see? Does that make sense? Or should I ask that differently?
Say that again, Magdalene. What would I have wanted?
So thinking about like all the work that has been done, right? But it happened very fast. So there wasn't a lot of time to think and evaluate as you're going along, right? You're just doing the work. But now that you've had time to kind of stop and think, even if it was just for a second, if you had the opportunity to start this again, what would you do differently so that as you're looking forward to the things that you'd like to affect outside of COVID and different things like that, you would already have that process started. You'd already be on that road.
So I'll start by saying that I think that funding for planning, right? Like, it would have been nice if we could have, which it was hard to at that time, like, but we know better now. I want to say that we know better. I mean, in fact, this week we received an opportunity to be part of a national initiative around pathogens and emerging pathogens, because the disaster is not, it's not when, not if this happens again, but just when. That's one thing. And then Giselle's point is well taken. What happens when you live in a pandemic every single day, which I won't go there. Right. But I do think that if we had funding to really help us to think and plan, and academic institutions and community partners could come together and say, how do we, in a planful manner, address the deepest issues and concerns and problems that we have in our communities? Like, that would be really, really nice. I was talking to DCR. So in the triangle, what would that look like for academic partners in this and community partners to come together? But around the country, what would that look like? And engage in that planning process and mobilizing those resources and all of that, such that when they're most needed, they're available, which for some communities is every single day, quite frankly.
Exactly.
Warren, what are you thinking?
Yeah, I was gonna say, Warren, did you want to share anything on that?
So in some ways, what we're moving towards is a more prevention model, right? How do we make sure this doesn't have the impact in the future? I think looking back, I have a hard time imagining we could have done a whole lot better with, kind of the fortuitous, unfortunate, horrible situation we were presented with. things did go remarkably smoothly. Yes, could we have had more planning? Absolutely. I mean, it's something I got to see up close and personal was just how poorly designed our CDEs were and how we were asking people to do things that if I could go back and do over again, I wouldn't do it the way we did it. Absolutely wouldn't do it that way. But those weren't the cards we were dealt at the time. And I think what Al is pointing to is we need to be more prepared.
Mhm.
One of my favorite quotes, and this is from General Eisenhower when he was general, not president. He said that in the time of war, planning is everything, plans are nothing. And what he meant by that is as soon as you get into a situation like the pandemic, what you thought was going to happen isn't what's going to happen. But the fact you planned for it, you have capacity, you have resilience. That makes all the difference. So I think those questions are exactly right. I don't know how to do it, but I recognize we absolutely need to build more resilience into our communities, into the system. What does give me, back to hope versus not hope, what gives me a lot of hope actually is long COVID, because it's impacting everybody. It's not targeting out specific communities. I think some communities are going to experience a differential impact. But the advantage of it hitting everyone is that means there's going to be resources behind it, right? So how do we solve problems in long COVID? Because those are going to impact the health of the nation, the health of the world, probably for the next, I'm not sure, 10 years, let's say, until we hopefully figure it out. So I think it's how do we take advantage of some of the investments that's becoming clearer and clearer that we as a nation need to make? How do we take advantage of that? Again, I don't have the answer there. I'm hopeful that in fact, the really smart people on this call will have some some ways to do that.
Exactly. And I think, as we wrap up, I feel like this conversation has gone by like so fast, but it's been an amazing conversation. And I think that, you're all making very key and important points, and people in the chat also agree. And so just as we wrap up, I just want to wrap up with one quick question. When I think of the pandemic, I think, the pandemic was really about isolation in a lot of ways, right? Quarantining, social distancing, people not being able to engage. But the work that helped us move forward in the pandemic was 100% about engagement and building relationships and building partnerships, which almost seems like, contradictory, right? So just for us to leave like on a positive note, thinking about that and thinking about how important engagement was in this work, what are you most hopeful for as we move forward, especially in our understanding of community engagement and its importance in public health initiatives in that work? And whoever would like to take that question first, jump in. Not all at once. Okay, I'm gonna go to Al. Al, we'll start with you. What are you most hopeful for?
Well, I hadn't really thought about it, but Warren's challenge to me, to us on the call and to others and the chats that I see, is to really perhaps move forward with a bold set of recommendations around this work. And that might not be anything that will be funded at this present moment, but I'm hopeful that we can do that. I think the lessons we've learned through RADx-UP and just this partnership are just amazing. I mean, the fact that CCPH is at the table. I mean, I know that may seem like nothing to some people, but to most community-based organizations, that's everything. And so I believe that we're positioned as a team, as a group, as colleagues, friends, to make a set of bold recommendations regarding future funding in the public health arena. And we need to do that to make those recommendations and share them with federal officials, state, county, and even philanthropy, the business sector, and all of that. We learned something, and we just need to document it and share it. That's what I'm most hopeful. And that as a result of that, there's some replication of this work can come forth. Giselle, what are you hopeful for?
So my hope is that, that the success of this initiative, not just the CDCC, but the entire RADx-UP consortium, would be recognized and supported beyond. And the strategic directions that we spent a good bit of time in our second year developing around exactly these issues, sort of how do we move from pandemic response to responding to long-term, long enduring health inequalities, and how can we leverage this infrastructure to be able to do that? That to me would be my hope. And because I think that we have exactly the right people, not just in the CDCC, but also across the nation, who are deeply engaged in this work. And we've been able to extend that to community-based, I think almost 50 community-based organizations who are already out there doing work around COVID-19 testing and vaccine access. So we have a tremendous infrastructure of 127 projects, more coming on board in the next couple weeks, almost 50 community-based organizations across the nation. This is a network, a consortium, an infrastructure that could be mobilized to do something incredibly important. So that's my hope.
Yeah, and at the heart, yeah, I mean, thanks, Giselle, you reminded me about our at-home testing project, which all of us have been involved in. That was amazing, right? Like, we literally were able to distribute over 1.5 million test kits across the US in a matter of weeks.
Before it was, people were doing that.
Yeah, before, I mean, people didn't even believe that they existed, and we had access to them at the point of working with the manufacturer to get them to local communities. Just unbelievable. But we did it. And we did it because of our national relationships. And so I think, again, Giselle, your comments just make me think about how do you replicate that to address other similar kinds of problems in this country? Warren, you've got the last word on this.
Oh boy. Well, I was actually going to bring
better be good, Warren.
I was going to bring up actually Say Yes COVID Test and You and Me COVID Free, because what I watched, and this was really, it was really fun for me to see how both Share and CCPH were really able to go into these communities, work with them, get them excited, get them to test. And looking back, and I hadn't appreciated this at the time, the biggest challenge, particularly in Pitt and Hamilton counties, not so much a problem when we made it out to California, but in those first two interventions, people didn't know what an at-home test was. And so that to get them to understand it, use it, and benefit from it was a really big hurdle. And we did it. You guys did it. And that was just amazing. So then watching what happened in California and being able to take advantage of what we'd already learned, creating that toolkit. Here's how any organization can really replicate the success with a little bit of expertise, will, and training. I think that's amazing. That's one of those legacy pieces.
Exactly.
But I think it's also about being, I don't know, a little bit of an opportunist. I'll say that when Giselle was the one that brought Say Yes COVID Test to us, and I got to say, what NIH wanted was probably not as valuable as what it became. And so there was a little bit of not just negotiation, but kind of revisioning what it was we were being asked to do. And I think that's always the challenge. How do we take the things that we see that we can take advantage of and repurpose them into something that actually really hits the mark? So I think that's great.
Oh yeah,
you guys
exactly.
are amazing.
Yeah, I'm really excited. Let me just say I'm very proud to be, a part of the CCPH team and also part of the CDCC RADx-UP team. It's been really tremendous work in a time where I think a lot of us needed, something to keep us pushing and keep us going. So I want to share really quickly before we wrap up. One, links have been put in the chat so you can learn more about Say Yes COVID Test and also You and Me COVID Free. We really encourage you to learn more about that. We also encourage you to go to the CCPH website. There's a link to our site there, learn more about the work that we're doing and the ways that we continue to partner for the past 25 years and how we'll continue to partner in the future. Before we end, we're going to put a link in the chat for the evaluation. We really encourage you to take the evaluation, help us learn more as we continue in our partnership series. And really quickly, so the next webinar in our partnership series will be focused on CCPH's principles of partnership. And really quick, Alan Wells, who is an evaluation specialist with CCPH, would like to just give a quick 1-minute teaser about our next webinar in the series. So Alan, I'm going to hand it over to you.
Thank you very much. Y'all ready to be teased? That sounds good. Tease. This has been fabulous. I just love working with CCPH. It's an honor to be with the PIs today. Giselle and Warren, I have nothing but respect for you all and all that's happened. It is indeed true that community engagement has been revealed to be of such importance in such a bittersweet way during COVID. And it's also very important that we have all gathered here today to say that we need to leverage the infrastructure that we have here. We have 127 projects, we have 50 CBOs, but what do we do with what we've built? And our next series of webinars is going to be dealing with just that. How do we facilitate partnerships? How do we plan to support partnerships? I think we believe in our team is that there is a huge amount of expectations from funders on community partners, but no real support for them in an organized and systematic way from the get-go. And that's what we're going to be talking about. The principles of partnership that CCPH has developed over our 25-year history will be put into practice with facilitation, with goals and aims, funding planning, equity strategies for partners and sustainability. These sorts of topics will be there, and they're going to be highlighted with the principles of partnership. And I hope y'all will come. Thank you very much, Megan.
Thank you, Alan. So first, I just want to say thank you to everyone for attending today. Thank you for, being a part of the discussion in the chat. We really, really appreciate it. And we've really enjoyed this conversation. I hope everyone learned something and was able to take something from this conversation. Again, we look forward to seeing you as part of our next webinar. I want to thank the panelists for taking time out of your day to talk to us today and to really share your insights. It's been amazing. I hope everyone who's on here has an absolutely amazing day. Thank you for joining. Please complete the evaluation, and I hope you have an amazing week.
Thanks, everyone.
Thank you.
Bye-bye.
Thank you, Magdalene, for running this.
Thank you.
And thank
Oh,
you
no
all.
problem.
We are
Thank
not
you.
done yet. We are not done.
We're not even close. We're not even close.